So antibiotics are medicines that are usually taken internally, for example, by mouth or even by injection, but sometimes externally in ointments and things like that, which attack what we call germs. Other people might call them microorganisms, but without damaging human tissues. The word antibiotic is usually used to refer to drugs that target bacteria rather than other kinds of germs, but some people use that term more loosely. The best known antibiotic that people will be familiar with is penicillin and drugs derived from penicillin. Penicillin is actually produced by a mold, and lots of antibiotics are natural molecules produced by one germ in order to kill or suppress other germs. And that probably reflects competition for nutrients in the natural world. But as I say, an awful lot of antibiotics are derived originally from other germs, particularly germs that live in the soil. Well, no, they're not. There are several different classes of germ which can cause infection. Some of these are single cells like bacteria or yeasts. Some of them are multi-celled organisms, usually called parasites. For example, people might be familiar with the malaria parasite. And also infections are caused by viruses, and these days we're all increasingly familiar with the idea of a virus, and viruses aren't cells at all. And because they're so different, there isn't a single antibiotic or a single drug which treats all infections. In fact, there isn't a single antibacterial drug which treats all bacterial infections. And that's why it's important to know exactly what you're treating before you embark on a course of treatment. It's also true that we all have bacteria, particularly, and other kinds of germs living on our skin, up our noses, in our mouths, in our intestines. And those are not doing us any harm at all. In fact, they're probably doing us good. So we need to distinguish between the friendly bacteria that live on us and are doing us good, and the unfriendly bacteria that might cause infections that we might want to treat. The important thing is to understand that there's no single antibiotic or drug that will treat all infections, and in particular, a drug that's targeting bacteria won't do any good against a virus infection, for example. Unfortunately, the answer to that question is yes. All drugs have side effects, and antibiotics are no exception. For instance, between 5 and 10% of people develop a rash when they take penicillin, although actually a lot of people who believe they're allergic to penicillin are not really. But antibiotics have two particular side effects which don't apply to other drugs. One of those is the impact of antibiotics on the so-called friendly bacteria that we've discussed before. So you might take an antibiotic to treat, for example, a respiratory infection, but it will still have an effect on the other bacteria in your body. And if they damage the friendly bacteria, then that can lead on to problems. For example, it can cause a thing called antibiotic-associated diarrhea. Usually that clears up very quickly when you stop taking the antibiotics, but sometimes it can be severe. Another example might be if you damage the bacteria that normally live in the mouth, then other things can proliferate and cause problems. So you can develop thrush as a consequence of taking antibiotics for an infection somewhere else. The second thing that antibiotics can give rise to is antibiotic resistance. And this is because when you give an antibiotic to a patient, even if most of the bacteria do as they're told and succumb to the antibiotic, one or two might survive. And if they then proliferate and spread, that can be a source of resistance. And we've seen resistance to antibiotics spreading throughout the world, really ever since antibiotics were introduced in the first half of the 20th century. And where we are at the moment is that most infections can be treated with antibiotics as before, but some infections are becoming more resistant and they require so-called stronger antibiotics. And very occasionally we see infections that really can't be treated with antibiotics at all, and that's the major worry. Well, it's understandable that while you and the people you care about are fit and healthy, antibiotic resistance might not be at the top of your list of concerns. But all of us will need antibiotics at some time in our lives, sometimes for minor infections, but sometimes for more serious infections. When we need antibiotics, we really want them to work. People won't remember, but before antibiotics were introduced in the first half of the 20th century, people used to die of infections that these days we'd regard as eminently treatable. So that's really why we should all care about antibiotic resistance. It is still unusual, as I said, for infections to be untreatable, but our concern is that sometime down the line, a few years hence, maybe 20 years hence, it might be more common to see infections that we really can't treat with antibiotics. And that is really why we're so concerned. Even if it doesn't get to that end point, there is still a concern that sometimes you might have to use more toxic antibiotics or antibiotics that can only be given intravenously rather than as tablets. And really, these are the concerns that we have, and these are why we should all be motivated to do our best to prevent the spread of antibiotic resistance. It is tempting to think that as organisms become resistant to antibiotics, the pharmaceutical industry will come to our aid and invent new antibiotics. Unfortunately, that's only true up to a point. And certainly over the last 15, 20 years or so, the germs have been evolving faster than the drug companies can keep pace. So for all of these reasons, it should be not at the top of our list of concerns, but it should certainly be something that we're aware of and that we do our best to limit the spread of antibiotic resistance. Well, the main thing is that they should only prescribe or use antibiotics when they're confident that they're dealing with an infection that will respond to those antibiotics. So we talk about asking people to use antibiotics less and to use antibiotics better. Antibiotic use in this country has been reducing, more so in primary care and in veterinary medicine than in hospitals, it has to be said, but we still use twice as much antibiotic per person as some other European countries do. So there definitely is a further way to go on this. But there are some difficulties. When you're faced with a patient who's got an infection, you do want to give them antibiotics sooner rather than later. The important thing is to distinguish patients who will benefit from antibiotics from patients who won't, and to give patients an antibiotic with the best chance of working rather than one that will prove to be ineffective. Well, obviously there's a limit to what an individual can do against what is an international problem. But I think there are 4 things that people can do. The first and most important is to use common sense to avoid infections in the first place. If you get a wound, clean it and cover it. Don't smoke, because smoking increases the risk of respiratory infections. Keep hydrated, because dehydration is a cause of urinary infections. And if you're diabetic, do your best to manage your diabetes as well as you can. The second thing people can do is to avoid seeking antibiotic treatment for things that are probably not going to get better with antibiotics, particularly viral infections such as colds or flu. Another example is diarrheal infections. Those normally get better by themselves without recourse to antibiotics, and in fact antibiotics can sometimes make them worse. The third thing people can do, if they're prescribed antibiotics, take them as directed. Don't take half a course and then put the rest in the bathroom cabinet. Take them to a pharmacy if you really don't think you need them anymore. Fourth, think about food standards and where your food comes from. Generally, food produced in the UK and Europe has been produced to high standards, but in other parts of the world, antibiotics are used indiscriminately in food production. So inadvertently, you might be promoting the spread of antibiotic resistance. There's an old saying that still holds good. Antibiotics, don't wear them out.